So the healthcare system in 20 years' time, it's quite a big ask, because if you look back 20 years, the healthcare system was exceedingly different, even 20 years ago, which was during my career. We're looking, I think, to a world where, with the changes in the population, particularly in Western society, of a very different feel to the way that health care needs to be delivered, and indeed preventive activity needs to be thought through. So if we really start to understand that the things that affect individuals and their health are actually things that start very early on in life, we need to have an emphasis on that. So we need to be thinking right from the word go in people's lives about how we're going to maintain their health, but equally we're going to need to shape our health services and our health system to, for the obvious fact that we're going to have more people living longer with chronic disease. So I mean that's the major picture. I mean the question, how do I think it's going to look? I think inevitably we're going to see a more diverse provision of healthcare, and I don't think that's a political issue. I think it's a reality. I think it's the way the world is going. They're more diverse, and that's good, because I think it'll mean we can focus on specifics rather than more general. So I would hope that in 20 years' time we are able to look in a much more bespoke way at individuals and how they lead their lives, what they need to have to prevent their ill health, and indeed when they fall ill, some very clear understandings about what needs to happen in the health service. I mean that's pretty general, but that's the sort of shape